We should get going.
Oh, we're on air now.
Yep, we're on air right now, so everybody behave, please. I'd like to call the meeting to order. Let's do the introductions before the open meeting law situation. So, Iola, why don't we start with you?
Iola Stallings out of Ettrick. Glad to be here. Woke up this morning.
Jeannie?
We have to make her a Brewers fan though.
She's from not this state.
I know. I'm Jeannie Nutter, I'm the County Board Supervisor in the 15th District.
Rita Straw, Elder Benefit Specialist at the Aging and Disability Resource Center.
May want to push your mics on and then off again when you're talking, because they may not hear you on the TV. Jay?
I'm Jay Hine. I'm the Human Services Director.
Brand new.
Brand new.
Congratulations and welcome.
Kevin Adams, District 7, and I'm also the Vice Chair of the Board of Health.
Omar Sharif from Blair, Wisconsin.
Sometimes known as Alan Robertson.
We know it as well.
Dye your hair black though, and then you would look like him.
I can tell you the story about it, but we need to get on with the meeting.
Right.
We can talk about after.
Beth Killian from Arcadia.
Mary Beck from Whitehall, and I'm back.
Rachel Harmon, volunteer from Pleasantville.
Jessica Rutherford, Administrative Assistant at the ADRC.
Melissa Youngbauer, Supervisor at the ADRC.
I'm Scott Brown from the Whitehall area, serving as chairperson of this meeting. So the open meeting law has been met through the proper posting. We need to adopt our agenda. It's hopefully you either made one or picked one up on the way in.
I move to adopt the agenda as written.
Okay, Jeannie moves to adopt.
Second.
Seconded by Alan. All in favor say aye.
Aye.
Opposed, nay. Motion carries. Thank you. Minutes of the June 13th meeting. Were there any questions or additions or corrections? And I'd entertain a motion to adopt the minutes as they were presented by Jessica.
I move to adopt them.
Forgetting my mic.
Jeannie
Move to
moves to
second them.
adopt. Alan seconds. Alan's got his finger on, and Jeannie keeps jumping right in there.
Oh, I'm sorry. I forgot to turn my mic on, but it's on now.
So all in favor of adopting the minutes, please say aye.
Aye.
Opposed, nay. Motion carries. Thank you very much. We still have we may have a person that is going to fill in for the open position, Colleen Schwerke. She could not be here today because her husband, who's having some heart challenges, had to go with him to an appointment. So I think we can excuse her today for that. But we would need to vote her in and then pass that along to the Human Services Board for total approval. Do you know a little bit about her background?
What I can tell you is Ron Johnson, one of the board members from ASIO, had recommended her, and I had a chance to speak to her. Colleen has volunteered as a home-delivered meal driver since 2019, and just does an excellent job, very dependable for us, and sounds like she's very interested in serving on the council. So she is from ASIO.
So she would take the spot that Ruth Gullickstrud had?
Yes.
Okay. All right, then I'll stop looking in my area.
Okay.
I will make a motion to approve Colleen Schwerke for the ADRC position.
I'll second.
Beth moves, Jeannie seconds. Any further discussion or questions? All in favor say aye. Aye. Opposed, nay. Motion carries. We'll welcome Colleen hopefully next month, or 2 months from now. 2 months from now.
We are. Yes.
It's a miracle. Okay. Meeting date and time. We needed to kind of make an announcement because of our bylaws. We couldn't change it last month, but we discussed that we often meet the day after Human Services meets, and we are an advisory committee to the Human Services Board. So it sort of made a little bit of sense that maybe we'd meet on Monday morning rather than Tuesday morning so that we could run through the agenda and get some ideas out there, give our approval to send on to the advisory board or to the Human Services Board. And that just seemed to make a lot of sense. So any other ideas there or thoughts or?
No, I don't.
I don't think there are any other meetings in this room on Monday morning. It's the second Monday, correct? Because we meet the second
yes,
Monday.
yes.
The Human Services meets the second Monday. Yeah, and I know Exec Finance is the first Monday, and Pete's heads on Tuesday. So I don't think there are any.
And you had looked at the schedule.
Yeah, yeah. So I think we're good.
So we can vote on it today, Alan, is that correct?
I don't see why not.
Okay.
Do we have a time?
That's the other thing that we had talked about, do we want to go back to 10 o'clock rather than 10:30? Is that going to cause any problems with folks?
For me, that half hour won't make a difference.
No, it's
Okay.
fine with me.
Okay, so I'd entertain a motion to move our meetings to 10 o'clock a.m. on the second Monday every other month.
I will second that.
No, I entertained the motion, I can't do the motion, but if you want to,
I'll make the motion
okay,
as to do as you said.
yep, second Monday at 10 a.m. Is there a second to that motion?
I'll second.
Any further discussion? Beth?
I do have one question. I looked at October, and that is Columbus Day. Is the courthouse closed for Columbus Day? Is that a holiday? Okay, I mean, it doesn't affect me. I was just wondering if it's a holiday.
I'm glad you brought it up and posed the question, because yes,
Can we
that,
change that to indigenous? Well, I don't know if the state did, but it feels like we did.
What's my calendar says?
Yeah.
Okay,
Anyway,
I'm good there.
well,
Okay.
we're here. I mean,
yeah.
Okay,
we're here.
motion's been made and seconded. All in favor, say aye.
Aye.
Opposed, nay. Motion carries. Thank you.
The next meeting will be next October, the second Monday.
At 10 a.m.
Over.
right here.
Don't even think about it.
October 9th, you said?
We'll be wearing sweaters. Maybe.
Probably.
Yeah.
Maybe in summer, if you have.
It'd be hot.
Okay, discussion of the nutrition program and a request for proposal.
Okay, so wanting you all to just be aware that our current contracts for our nutrition program all end at the end of 2023. So what we will be doing is, we've already started working on the new updated paperwork for a new request for proposals. So this would be for all of our home delivered meal providers and for all of our senior nutrition or senior meal sites. So kind of wanting you to be aware of that. Historically, we have done 3-year contracts with all of our food providers. Of course, that all kind of changed during COVID. We had a lot of providers that ended their contract prematurely. So just kind of wondering about whether or not anybody had any thoughts about, do you feel like 3-year contracts, do you think that's a good thing to do? Do you think a 2-year contract, would there be any benefits of that? So just looking for just any thoughts.
I don't know how I feel about it, but I think it might be better for the people we contract with to have 3-year ones, that you feel a little more secure. I mean, obviously, if something happens, like Rainbow closed and you had to make decisions, but I don't know. I feel good about 3-year contracts.
Beth, you have something?
Yeah, I'm just thinking a 2-year might be better with the prices of things on how they fluctuate so
That's
much,
true.
the increase in price. Maybe when you contact our providers, see what they would prefer. I mean, 3 is fine, but, maybe 2 would be a little more realistic with the economy.
So maybe have an option, if you could do a 2 or a 3, have option either way.
It's hard to do a contract with that.
I guess you have to pick one or the other, but I could see some points with, especially lately with the economy and things fluctuate, I can see why you might want to do 2 instead of 3. Things are all over the place.
I will say when it comes to the cost, if we do 3, the one benefit to county is then our prices are locked in for a little bit longer period of time. But to your point, there's also the providers and their costs and things like that. So yeah, it's kind of a balancing act, really.
I'm good with either.
And I suppose the other aspect too would be to whether or not we increase our donation line to, like 450 or 5 or something, just in lieu of the rising prices all around, but
They are going down though.
true, thankfully. Just a thought.
Yeah, any other feedback? I guess those were the 2 things that I've been thinking about. I think what you're saying, Beth, maybe I should just pose the question to current providers and just see what their feedback would be. We value them greatly, and yeah, I would like to see what.
You have a couple months to.
It's through December, right?
Through December.
Yeah, so
Yeah.
it's only
My plan
August.
is that looking at possibly sending out the RFPs in September.
Okay.
We haven't decided on an exact date yet of when they would be due, but I think the sooner the better, because it gives us time to, if it's just so unknown at this point.
Right.
Until we get them back, we don't know what the prices will be, and we don't know. Hopefully, all of our current providers remain interested. So,
Could you list them all just
so that
so we
you're
all
aware.
so everybody knows who we're dealing with?
Sure. So our current home delivered meal contracts, we have 3 contracts. We have Eau Claire County, we have Grandview Care Center, and we have the Ashley Pub in Arcadia. Our current meal site providers include Boondocks, Sweet Temptations, and Ashley Pub. And then we have our one meal site, Pine Creek, which we operate. So that's 3, right? Yeah, I don't think I'm missing anybody.
This one is strong, did you mention that one?
So the one in Strum, the 2 sites, the one in Strum and Blair are both catered by Sweet Temptations.
Okay. All right.
Yep.
So I've been to the strong one, so.
Yep. Okay, so what I'm hearing is, yeah, people think 2 or 3 and kind of explore them both. Okay.
And I think, Melissa,
Thank
you
you.
and I have talked about kind of, I mean, we've had some dreams, some bigger dreams of how we'd like to see things happen maybe in the future. And so I think we've talked about what are the possibilities going forward, especially to have more, and you're more eloquent about this than I am, but just to have more coverage throughout the county and give people more access on more days, that's a little bit more equitable, I guess, across the whole county. And so right now, it's just by the virtue of how things have played out, I think that's not exactly the case right now, but those are some of the conversations that I think would be good to have and to figure out, how can we make it more accessible to more people, the opportunity, so.
I couldn't say it better. No, that's that's good.
So if we have some thoughts on maybe another restaurant that does, can we present that in there? And I can't think of the name of it to save my life, but I know where it is, and I've been over there, and the food is good, and it's run by vets.
Yep. So when we have done our requests for proposals in the past, we have tried to get a list or a database of all of the known restaurants and caterers in our county. And so we send that to all of them. But in case we may miss somebody, we certainly can share that with any of you, that you could give it to individuals that you know of. The other thing that we're required, because we're a government agency, we also need to notify the public of that. So we'll have advertising in the paper and out at the entrance about that we're soliciting bids. So we want as many people to come to us and let us know if they're interested in.
Reach out to them because they're in Galesville,
Okay.
kind of like in the back in the booth
Mhm.
over there.
Yep.
It's really nice area. You got a lake. It's really nice. I
Mhm.
was surprised.
Yep.
Sitting back over there. Food is
Because Galesville is, you're right in between Galesville and Ettrick, so you can go to either place.
Right.
They have the nice lake there, yeah.
Mhm. Yeah.
Jeannie, did you have a question or a
No, I was
comment?
gonna Google and see if I could
Oh.
find the name of that restaurant.
Yeah. I'll ride by there and get lunch today.
Any other questions on the nutrition program?
I do think there's one other option too that is probably out there that we could explore, and that would be as the new provider is selected for the new jail to provide meals there. Would that be an opportunity, for and if that provider has capacity, and sometimes those economies of scale can be a good impact on the price and make it more competitive. So
Is it Arctic Springs?
Oh, they're, I know Arctic Springs,
That's
they're
they have
cool.
new owners, so
Yeah,
yeah.
they're nice people. I've been there with the new owners. It's a beautiful place.
Unfortunately, they only open at 4 p.m.
Oh.
So it's dinner. Well, you
But
could have a
they-
dinner
They
site.
could be, but they could be interested in
Right.
Yeah,
another time.
expanding a little bit. It's
Different time.
Yeah.
1 or 2 days at
Yeah,
noon
exactly.
or 11:30?
Mhm.
Okay, well, do you have enough input,
I think so.
guidance?
Yeah, it's helpful. Yes.
Okay.
Thank
All
you.
right. Discuss possible suggested contribution increase for home delivered meals and the senior dining program, and possible increase in the volunteer driver rate.
Yeah, so Jay can jump in here as well. But we've been working on our budget, our 2024 budget. And so, of course, we're looking at how do we continue doing what we're doing with our nutrition program. We can start just talking about that. Again, we've just mentioned that we're not sure what we're going to be looking at as far as what we're paying our food providers next year. So that being said, one of the things that we would like to do is to increase that suggested contribution for our home delivered meals and our senior meal sites, to raise it from $4 to $5. Again, it's a suggested contribution. So when people come in, they could pay nothing, or they could pay what we
10,
suggest, or they could pay 10. What we estimate is that it is costing us $14.42 to provide those meals. And so when we ask people to contribute or if we raise it to $5, that is to offset the costs of wages, the food costs, etc. So looking at what we're currently taking in for senior meals, it's right around $3.89 on average. So people are giving pretty close to what is being suggested. I just feel, looking at this 2024 budget and not knowing what the costs are, that would help us continue what we're doing and keep the program, I guess, operating without having to make any necessary cuts, at least to the program. So,
Home delivered meals, $5 as well?
That's
Or is that
what,
for now
yeah,
and it would go to
when
5?
we were looking at the budget, that is what we are looking at, I
So
guess,
you're
for
looking at
2024.
increasing it to 5, which is really reasonable.
Especially for what you get for a home cooked meal, I think that you can't go even to go to McDonald's for that. I think that's more than reasonable, especially when it's just suggested.
Maybe even 550.
Do I hear 6? Going.
One other piece of that, I will just say, it does seem to be in line with what other counties are doing. I know Eau Claire County just increased theirs to $5. It's something that the state definitely keeps track of. They know what it is, just in line with what other counties are doing.
If Eau Claire is at 5, then we shouldn't go to 550, I don't think.
Okay.
There might be a little bit pushing in as a
Yeah.
smaller county to go more than them, but I think $5 reasonable.
Yeah, I do too.
Ellen?
Mr. Chairman, I would move that we increase the voluntary donation to $5.
I'll second.
Okay, motion's been made and seconded. Any further discussion? All in favor say aye.
Aye.
Opposed, nay. Motion carries. Thank you. I think in the past, we've only raised it like a quarter or 50 cents at a time, so going up $1, rather than $1.50 is probably pretty prudent at this moment. So thank you very much.
Yeah, looking at the future, I feel like that's the case. The other piece that we do feel at this point that really we need to make an increase in is the volunteer driver program. Looking at the budget, really when we put the numbers and got everything on the table, the question was, can we make this program, can we continue with this program? I don't think that we can continue without a rate increase in that. We don't have funds that are coming in to pay for that. So unless there was additional county levy dollars, I don't see how we can continue to operate that program. The volunteer driver program, currently we are paying volunteers the IRS rate. So we're paying them 65.5 cents a mile to take people to their out-of-county medical appointments. So again, this is out of county. We're paying volunteers. So we are charging current customers 30 cents a mile. What we are suggesting is that we ask the customers or the clients to contribute that 65.5 cent rate to pay for the drivers. So any conversation or discussion about that?
I can say, I know that's a significant increase, but at the same time, we really, with the way the budgets are going and projected fuel costs and all of those pieces, it's challenging to maintain the program if we don't do something, like those increases. So, it's budget right now is very challenging, to be honest.
Where is the furthest a driver has to, do you go to
Occasionally
Rochester?
Occasionally Madison, occasionally the cities.
So that would be a big amount, 65
It
times.
will. What I will just let people
257
know
miles.
is we are not transporting individuals that are on medical assistance.
Okay.
So those individuals that qualify, that meet the income or asset requirements, they're using the state program. They're using the VAO for transportation. So these folks, they're either paying privately. If they don't qualify, or if they potentially could qualify for the state transportation, we can assist them, and we do assist individuals apply for that. But otherwise, we do have contracts then with the family care programs, and so we are, at times, we are transporting individuals, and then we are getting reimbursed by Inclusa or My Choice. So.
Is that good, the people to go to RCU and a quick trip?
Nope. So that would be under our specialized transportation. So that rate, we had, I think the last meeting, we talked about that. So those rates are being increased to $3 for that
I
in
would
county.
be glad to pay $3 because I'm glad to get a ride to go to RCU and Quick Trip. And sometimes the dollar store.
Yep. So this would be the medical appointments that are, most of the time we're taking people to Eau Claire or La Crosse.
Okay. I feel like I should know this, so, but
No.
no.
Yeah,
So
yeah.
what is the intersection between our volunteer drivers and the RSVP program?
The RSVP program, their mission is to have volunteers, I think it's 55 and older, does that
Right.
sound right?
Right.
Where they provide them with volunteer opportunities.
Okay.
So they are at any time trying to recruit volunteers for our organization. So they don't provide any kind of compensation to their volunteers or to us for, right. That's how that works.
Okay.
I think it's only fair to do the IRS rate, because if you travel for work, you get IRS rate for reimbursement. If you're going to do your taxes, and I'm not, a tax expert or anything, but, if you're going to deduct your mileage to medical appointments and things, I would think that they would use the IRS rate also. But I'm not sure about that. It seems fair. I know it's a big jump from 30 cents to $65.50. And if I was going to make a motion, I wouldn't specify the amount. I would just say whatever the current IRS rate is. So we don't have to change it every year. So I should make that motion? Okay, so I would make the motion that we start paying our volunteer driver rate at whatever the current IRS rate is.
Is there a second?
Second.
It's been moved and seconded to pay our volunteer drivers the IRS rate, whatever that is each year. Any further discussion? All in favor, say aye.
Aye.
Opposed, nay. Motion carries. Thank you. So there,
Wow, that was easy.
yeah. Almost everybody in the country's on union strike right now anyway, so, we don't want our volunteer drivers to go on strike for more money, so.
I learned that they had to limit gas production in Texas because of the heat.
Oh.
That's
strange.
what's causing the price of gas to increase.
Yep.
Because they can't, it's too hot.
Really?
I'm no scientist, so I can't explain it, but
In my opinion, not to go too much down there, but I think that's a whole bunch of. But that's just my opinion.
It's science, Kevin, it's science.
Science. So, if you read about it, it's very clear that they can't operate at the capacity or it'll blow up the.
Yep.
Oh, you don't want to do that.
Yeah.
Really? Remember BP, that one? Remember how it happened there? Yeah. Well, repeat or worse.
One thing I just want to add is when we talked about the rates at last month's Human Services Board, they had said very clearly that they would like us to review these rates annually. And I think that's a good idea. We had not raised those rates, those local and bus rates for several years. I think I went back to maybe 2017 and those were the same rates. So I think that's a good idea. So I think just plan on that in 2024 then. We'll definitely be revisiting the rates just to make sure that they're still we like where they're at. They are where they need to be for our budget and can adjust accordingly. So
is our motion current immediately, or are we talking 2024?
2024.
Okay.
Yep.
All right, I thought I just better clarify that.
Yes.
All right, anything else on increases in,
I don't think so. So the next time we meet, I think we should just expect that we'll have more information about contracts and discussion about what 2024 will look like. Because there could be a lot of changes. So it'll be wanting feedback about possibilities. It's kind of exciting, isn't it?
I hope they're good changes.
Yeah, we do too.
yep, yeah, for sure.
Yeah.
Okay, we're on the agenda to the point of Rita's going to talk to us about her job, so floor is yours.
Verify, she helped me when I turned 65 and didn't understand Medicare.
Me too.
Okay, I am the Elder Benefit Specialist at the Aging and Disability Resource Center. I work with basically anybody over 60 who has basically any kind of questions. In particular, I can help with Medicaid, I can help with Medicare. People come in that are already on Medicare and their drug prescriptions have changed, their drug costs have changed. We can look at pharmaceutical assistance, we can look at senior care, we can look at switching to a different Part D plan. There are options. There's initial enrollment when you first turn 65, there's special enrollments, and there's open enrollment in fall every year from October through December. But I encourage people, if they have a problem in between, to still call me, because we can still look and see if there's something else we can do. I help with Badger Care, those that are over 60. The Medicare program, Medicare system also has an extra help program that covers drug costs, so we can look at that. Some of them are income-based, some of them are income and asset-based. People inquire about Medicare supplemental insurance. I'm not an insurance agent. I just basically give them a list of insurance companies that are approved by the Office of the Commissioner of Insurance. They may ask about Advantage plans. I like to explain the difference when they're new to Medicare. Advantage plans, I can go into the Medicare website and enter their prescription drugs, which provider they want to go to for clinic, hospital, which pharmacy they want to pick their prescriptions up at, and we can sit and compare Advantage plans. And they vary a lot because there's a monthly premium, there's co-pays that are out of pocket, there's deductibles. So we really like to look at the whole year and all the prescriptions to make sure that they're actually getting the best bang for their dollar. Food share, of course. I help a lot of people apply for Social Security benefits, whether it's early retirement, full retirement, or Social Security disability. Help some people with housing and utilities. If they call in, they've got different issues. May send them to Western Dairyland. Sometimes we have rural housing. Basically, anything they call or come in for. I do see a lot of walk-ins, and that's fine too. I see as many walk-ins as I can. Some people don't like to use the phone. Some people like to come in and talk face-to-face, and that's okay. If I've got time in my schedule, I'll do that. I guess last year, in 2022, I assisted 427 different clients. 182 of them were new to me. So my computer system that they provide us keeps track of every time there's a new one entered, or keeps track if it's a duplicate or not. But 427 unduplicated clients, 182 new clients, and I spent 883 hours assisting with legal questions and benefits assistance. I got a report that breaks it down. I don't know, what kind of stats we're looking at, but 21% of those people were under federal poverty level. So that means for a household of one, they were under $1,200 a month.
How do you live on that? You don't.
You come see Rita, and we do the best we can with food share, Medicaid, housing, utilities. We do the best we can. And the other 78% were, of course, over 100% of poverty. 40% of those people lived alone. 59% lived with others. Only 3% of the people that I saw live in a long-term care facility, because we try to have the people go to the social workers at the nursing homes or facilities and start there. And if they have complicated questions, I'm always willing to help, but I don't want to step in and start messing things up when they've got their own routine down. 1% were under 59. I can see people under 50, under 60 if their spouses are over 60.
Oh, I didn't know that.
44% were between 60 and 69, so I see a large amount in that age group. 31% were between 70 and 79. 19% were over the between 80 and 89. 2% were over 90 to 99, and 1% were over the age of 100. So that gives you a little bit of idea of who I'm seeing, and I'll give you the percentages for what I'm doing with them. 61% of my time was spent helping with health insurance benefits, so that would be Medicare and Medicaid. Veterans benefits is in there. Badger Care is in there. 25% of my time was spent on income benefits, like food share, things to help monetary month to month. So food share, benefit checks. 2% was for community services and supports. Most of the time when they come in and they need things in the community, I'll give them what I can, and then I would refer them to probably an INA worker. Like last month, I guess Laura was here, INA, to see if they need some services in their home. I'm more of the financial person that helps them figure out the financial side, but I do refer them to the INA if I feel like that could be helpful. 2% was on housing and utilities. 1% was on like wills, powers of attorney, that sort of thing. And 8% was on other, because you just never know what kind of questions you're going to get. And that would include like issuing farmers market vouchers and that sort of thing. So that's kind of my year in a nutshell. I don't know if anybody has any questions.
Well, Rita is very modest, and she didn't start out by telling you how many years have you worked now in our department.
I've been with the county for, I've been with Human Services for 25 years.
Wow, yeah.
I've been in the ADRC for 9, almost 10 years. So before this, I was in economic support for quite a while. And before that, I worked in land records. So I've been with the county.
Yes.
I've been with the county for quite a while.
She's just a wealth
So
of
you have no plans
knowledge.
to retire, I hope.
Yeah.
I don't want to retire
Okay,
anytime in
good.
the near future. I did buy a Powerball Megabucks ticket.
I know, I'm gonna buy one today. I'm going to quick trip.
But I
after
didn't
this.
win, so yes.
You can get the Mega Millions still.
Mega Millions.
So
yep.
she's truly invaluable. How many of you have said that you have seen her yourself? So
Yes, I
it's,
did. Like right after my
um,
birthday.
Mm-hmm.
And you sent me to a really good insurance person to help me with the supplemental.
But she really is an expert. She's like our go-to person at the office because she knows.
I'm glad
Yeah.
you guys know. I mean, it sounds good, but me being probably the baby in this group, I would have no idea. It's a quote kid.
Well, don't worry about it now.
Yeah.
Jessica will attest. A lot of times we've got a lot. I mean, we've got a lot of people. We're rural. We've got a lot of people in this county that, you know, they're getting mail in the mail from all these different places, and it looks like it's junk mail, but sometimes it's really important things to take care of. Like they've been switched to a different drug plan because they answered a couple questions over the phone, and to them, that walk-in service is really important because they're panicking.
Yeah.
They got something in the mail, they don't know what it is. So yes, I do see a lot of walk-ins, but it makes the day interesting and go faster, I guess.
Yeah.
Someone comes in with a stack of mail, I know they're there to see Rita.
So this is probably a longer discussion, but I know there's a lot of people talking about the difference between Medicare and Advantage plans and saying Advantage plans is not Medicare, it's a private health insurance.
Correct.
Can you put that in a nutshell that helps me understand
And I
it?
do, I mean, I have a little map that I go through when people come in, and we make notes on it, what they like, what they don't like, and I give it to them because there are only certain times in their life they can do a Medicare supplement. Because it is an insurance, Medicare supplemental insurance, they need to take it when they're 65 or have a special enrollment to get into it, because otherwise they're looking at taking a physical for the insurance company and the rates will be different and there's no guarantees that they can get in. Advantage plans are still insurance by name, but they're looked at more like a co-op. Everybody pays the same monthly premium, whether they're 65 and very healthy or 102 and have medical issues or vice versa. So the Advantage plans will have a lower monthly premium. Everybody pays the same, but they're locked into a network. So the supplements really allow them to go if there's snowbirds or if they want to go to different Mayo for this and Gunderson for this and Marshfield for that. Allows them more freedom, the supplements do. The Advantage plans, lower monthly premium, locks them into networks, and they have co-pays. But the Advantage plans are what are on TV that advertise all these extras that want to lure people in. And
Dental, hearing.
yes, and they will. I have had situations where they see it on TV, they call the number, they sign up, it all looks great, and then a couple months down the road, their cardiologist calls and say, we need to cancel your appointment. And they're like, well, why is my cardiologist canceling my appointment? They're no longer in that network, so they can't see their doctor. So then we have to scurry and see if we can find some sort of special enrollment to switch that back. And sometimes we can and sometimes we can't.
So you said there's gaps between the figuring them out. Which one, because I was gone, which one doesn't always cover? You were talking about people calling if there's a certain insurance. This might be on a network you're talking about. Is that the Medicare
Those are
Advantage?
Advantage plans.
Because that's not truly, so people get kind of, I hate to say had, when they go to that so-called.
It all sounds good, and they've got those extras that they're advertising, and some people, don't get me wrong, some people love their Advantage plan.
My husband
You know,
does.
and other people love their supplements, but it's to go over it when they're 65 and get the right fit for
So
that
they don't get
person.
a hole or a gap or a loophole or fall through the cracks.
Can you change your drug plan anytime, or do you have to wait until open enrollment?
Drug plans, on average, can only be changed during open enrollment,
Okay.
October through December.
Okay.
There are a couple special enrollment periods, so I tell people, we're gonna sign up for this drug plan, this is what you want, watch for the welcome packet to come in the mail, watch for the card. But if your doctor changes your prescription during the year, don't hesitate to call, because maybe we'd have a special enrollment to get you into a different drug plan. Maybe we could do senior care to help in addition to your drug plan. And if all else fails, we can look for pharmaceutical assistance
Okay.
directly from the pharmaceutical corporations. So
Thank you.
October is my busy time, but
That was the question. That was my next question.
but problems don't always wait till open enrollment. So
I'd see every once in a while, Rita, this thing that if you're certain age, you're allowed $3,500 a year for food or something. That's just a scam, isn't it?
no, that's not just a scam. That's our Advantage plans. They
Oh, it
used to
is?
just
Okay.
offer dental, vision, hearing, drug, and now there's several Advantage plans that are offering like a cash card that they can use $200 a month to pay utilities or buy groceries. It's not a scam. people who sign up for those Advantage plans get that card with $200 a month. The problem is in our rural area is finding a utility company that will accept that card.
Oh, that's the catch.
Or finding a grocery store that will accept that card, because our local grocery stores and our small town utility companies don't
So
always
it's usually
take
the
those
big
cards.
chains that'll accept them. So if they want to use that, they have to drive to Eau Claire, La Crosse, where like the big chains are.
Correct, or they
Oh,
have to
that's
have,
the catch.
they can't have a local utility, they have to have like Xcel Energy.
So they have to, whether it's the energy company
you'd
or the
have to
grocery
move
stores, they have
to
to.
get XL.
They would
So-
have to have the big chains, whether it's the grocery store or that's the catch. They have
That's
to have
the
the
catch.
big.
So
Yeah.
I hate to call them a scam, but you're right,
Kinda
it
is.
is a catch. So yeah, we see all
Big chain
kinds of
outlets.
interesting things.
So yeah, like I say, so like even on the grocery store, you have to go to the big chains in La Crosse or Eau Claire, and the same thing with energy. So it's not really a scam, but it kind of, there's always too good to be
You just
true.
have to live in the right place.
Right.
We have more people taking our buses to look across the road right now because of that reason.
And then, because that's where the big chains are. So that's the only.
So it's good for those, it's, it's very helpful for people who need that, it's just you have to figure out how you're gonna use it. You're not gonna be able to move, so you can get XL Energy.
But like I'm saying, they could take the bus to the bigger chains that do accept it. So there is pros and cons.
We're able to accommodate them in some way.
Right.
Yeah, on
Right.
that one.
Just don't do anything when you get a phone call until you talk to Rita.
Yes.
Because right now, in October, there'll be a zillion phone calls about Medicare.
Their phone will be
I
ringing
hang
off
up
the
on
hook.
Yep. Any other questions for Rita?
Not a
Beth?
question, but I was just going to make a comment. For what I see as the two, and I tell people is if you're on the regular Medicare, you make one payment, you don't have to worry about a thing. If you're on the Advantage plan, you're going to be saving money, but then you're going to pay for everything as you go along. So you have to decide, which avenue you want to go.
Right, and the Advantage plan looks good. It's got a smaller monthly premium and the co-pays seem minimal. And they're throwing in some dental, they're throwing in some hearing, they're throwing in some vision, and now they're throwing in this cash card type thing. But you have to look at the big picture. Are they gonna cover the doctor, clinic, hospital you wanna be seen at? And if you have a bad health year, and how much is the maximum you're gonna pay out? And what if you have 2 bad health years? Or what if you're married and both of you have a bad health year? That could be $10,000 a piece that you would pay out of pocket. And in which case you would have been way better off paying that supplemental premium of a couple $100 a month, so.
I was down in the cross, and thank God I was on medical assistance and Medicare and Medicaid, because they paid for everything, and I didn't have to pay co-pay or nothing. I mean, my garden didn't have to pay for my co-pay, and I'm so happy that we have a next door neighbor of mine, not next door, bed next door of mine. She had to pay co-pay because she was on another program, and the nurse said, "Well, isn't that a shame?" And I said, "Yeah," and I says, "I'm on Medicare and Medicaid, and I didn't have to pay anything. They pay it." But I was one sick person, so yeah.
We're glad you're back.
Thank you.
We
I'm
missed
glad
you.
I'm back too.
Thank you very much, Rita.
Thank
Very,
you.
very interesting. And Rita goes out and talks to the groups, actually a couple times a year now. You've done, I always forget the name of the program, but all you guys kind of do a presentation at a site.
Yep,
and
the
it's-
planning for the future that we've
Yep.
done, yep.
Yep, I can't remember those things anymore.
That's, that's okay, yeah.
Mr.
What's
Chairman?
important is she's, presenting and she's
And you have
there.
such a nice voice.
Thank you.
So calm.
Calm.
Because you're hysterical when you're trying to figure out
Thanks,
what
Rachel.
you're going to do when
Thanks,
you're
Rachel.
Absolutely.
65, because I was.
So you say that
Mr.
the best
Chairman?
time to reach you without being as busy
Oh, I'm
would be
sorry,
say
these
from
women
now
like to
until the
talk.
beginning of November?
Including our Madam Vice
Right,
Chair,
I
right?
get busy in October, but I try to allow, because there are, I always see walk-ins. So even in my October schedule, I do have to set aside some time for walk-ins and phone calls, so.
Alan?
I move we adjourn.
Oh, wait, we still have number 11.
We already discussed it.
Oh, we did already?
Yep,
Oh,
we
that's
discussed
right.
it. Yep. We're at the end of the
Right.
agenda, so.
God, Alan's
Not
in
lying.
There's a
hurry.
motion to adjourn. Is there a second?
Sure, I'll second.
Okay, all in favor say aye.
Aye.
Opposed, nay. Motion carries.
It's a young guy.
Thank you all very much. Appreciate your time.